Welcome to the Politics and Media programme. Last week, the UK Drug Policy Commission published the results of a 6-year-long study called A Fresh Approach to Drugs. It slammed current policy as not evidence-based and called for a wholesale review of existing laws. Reaction to the report has been divided. Some support the idea of decriminalising drugs, while others say that decriminalisation sends out the wrong signal to the UK youth. With me in the studio are Dr. Axel Klein, an expert in drugs policy, who's a lecturer in anthropology of conflict, criminal justice and policy at the University of Kent, and Haroon Mir, Deputy Director of NAFAS, a drug treatment agency working with the Asian community in Tower Hamlets. And we're joined on the phone by Roger Howard, Chief Executive of the UK Drug Policy Commission. Roger, let me come to you first. It's your organisation's report. Just outline for us the main findings.
Well, the report's been sort of 6 years in the making, but we have published various reports on the evidence underpinning drug policy in the UK over the last 5 years. And if there is one thread, one golden thread that runs through this in the DNA of the report, is that even though we've had some very good impacts in some aspects of tackling drugs, like with drug treatment for people who have drug problems and also keeping HIV and AIDS rates among injecting drug users low, and even though use of most drugs has been falling in the UK over the last decade, there really is, we can't get away from the fact that we're spending anything between £3 and £5 billion, and only some of that is based on good evidence. So the golden thread is that we must use taxpayers' money efficiently, and we must base drug policy much more on evidence about the impact that particular policies are having.
Okay, just let me ask you one subsidiary question on that, because I think many people listening to this, if they've formed a view about what's happening with drug use through the mainstream media, will be quite surprised to hear that drug use is falling. Could you just elaborate that a little bit?
Well, indeed. I mean, if we take cannabis use, for example, it started to decline in the UK, and indeed it's been going steadily down in other countries across Europe as well. The prevalence of drug use, that's the number of people that are using the drug, has been steadily going down since about 2001. And it is a bit of a myth that we're going to hell in a handcart, if you like, that really we can't get away from the fact that the prevalence rates have been getting better or lower. Yet at the same time, what we have is a solid core of people who have quite entrenched drug problems, particularly heroin users and crack cocaine users and some cannabis users. But we've been seeing the use of cannabis going down, and we've been seeing the use of other drugs, the prevalence rates going down. And the important thing about this, and I'm sure you'll be coming on to this later, is this connection between the law and drug use. And I think that this is a good indication, because in that time, cannabis was rescheduled. The law got tougher. The sentences that a judge can give out, the court can give out, hardened up. Yet this had no impact on the rate of cannabis use. So this seems to be, to us, to be a disconnect. And the issue about the law sending a message, really, I think, either a lot of people have not heard what that message is, or they've ignored it. So there is a disconnect.
Haroon, what do you feel about that argument? Because what Roger seems to be saying is, all right, they tried to introduce, or they have introduced, indeed, harsher penalties, but that isn't something that affected the use of cannabis. Mm-hmm. And does that general picture that he paints, does that marry up with your experience?
I mean, firstly, we welcome the kind of fresh approach to looking at how addiction can be tackled. And I think that, law has a place in society. Punitive measures have a place, and they do have a level of impact, because it often helps, people stay away from the actual, using drugs, especially what he's raised around heroin and crack cocaine. And I think the fundamental issue we should be asking is around, the prevention And right, what you said rightfully, which is what is the actual message that it sends out to the young people who are the next generation, and what society they'll be brought up in with legislation and so forth. We find when it was declassified from Class B to Class C at one point, young people were very confused about what was it legal or was it not legal for them to smoke? Where was it permitted? Where wasn't it permitted? And we also got to look at the motivation of why is it that we want to decriminalise drug use, and what is it that we want to benefit from by doing stuff like that? Because although drug use may have gone down, we have seen a lot stronger, more potent drugs being used on our streets by young people. We see more people home growing drugs such as cannabis.
Axel, do you agree that the law hasn't been behind the fall in drug use? And if you do, what do you think has been?
Well, first of all, I wanted to thank UK PDC for the report. Roger Howard headed an organisation I worked for about 10 years ago, and I'm glad that he's finally adopted the positions that I promoted all those years ago. He could have gone a bit further. But to stay with the question, the law, of course, has a role to play. It doesn't have a role to play when it comes to individual consumption of substances. Possibly not. I think this is something that we should discuss. Should the law really intervene with individuals and decisions they take over what they do to themselves? I think this is arguable. What you should look at is the consequences. What consequences does the consumption of certain substances have on people's behavior, how it affects third parties? That's where the intervention should start. When it comes to people inflicting harm on themselves, I think we are in very, very dangerous territory, and I think the law so far has failed. We've got a number of academic studies that looked, for instance, on cocaine policy. You have Amsterdam being compared with San Francisco. Very different policies, very similar outcomes. We find that social trends are much more powerful in determining consumption patterns than policies themselves.
What kind of social trends? What do you mean? Because I think viewers will be saying, okay, well, if it isn't the law, what is it that's
maybe you're trying to give a name to something that is very, very difficult to define. Fashions, trends, but maybe there are other things going on as well. Maybe there's a need for it. Maybe in a modern society there's a need for people to come together, to de-stress, and so on. They resort to various chemicals in order to short-circuit ways of enjoyment or de-stressing.
Roger, let me just come back to you. Axel suggesting that maybe the report should have gone further. What do you think?
Well, I mean, in one of the many conclusions in our report, and I wouldn't say this is necessarily the main conclusion, but one of the conclusions is that we could move from a system of criminal penalties for possession of small amounts of controlled drugs to civil penalties. So, in fact, you might get a small fine, you might be referred, for, as happens with drink driving, you might get a sort of a short educational leaflet or program. So there's a variety of things that you could still have legislation which sends a message. And I do take the point that the law tells us what sort of society we want to live in. We use the law to display really the framework, but what we don't go, where Axel perhaps would like us to go, is that we do not argue that relaxing the controls on the production, the supply and the trafficking of controlled substances, the penalties on that should be removed or significantly lessened. And the reason for that is, I think if we look at what has happened with alcohol and tobacco, what we see is the commercialization of these products. It's happening on a industrial scale now, and it's bringing with it a huge number of public health harms with that. We know that now. It's pretty clear. And I think we need to be cautious and resist that. And if we look at pharmaceuticals, I think around the globe now, people have estimated anything between 10 and 20% of in the global market of pharmaceuticals are counterfeited. They're fakes. And so I guess in this area, in drugs for pleasure, It's an area that lends itself open for rampant commercialisation and indeed for counterfeiting. And I think we argue you need to be cautious on that front.
I mean, Axel, that's a powerful argument, isn't it? That if you, I mean, whatever you think about the often it seems to people, I think, arbitrary distinction between tobacco and alcohol on one side and other drugs. It is a powerful argument that if it's brought within the law, then it's also brought within the ambit of huge corporations who will commercialise it.
First of all, let's pick up this point on counterfeiting. I find that really amusing because we do not have a market in pure drugs. Nobody's ever scored a bag of heroin that is not counterfeited and doesn't contain adulterants. In fact, it is the criminalisation of these drug markets that has created the adulteration and the mixing in with other products, the uncertainty that drug users have of what the actual strength is, which leads to overdoses. But yeah, let's take the corporate argument. Who's not to say that when we bring in, let's say, a cannabis market in a step-by-step manner, that we introduce new ways of regulating the market, with a ban on advertising, for instance. Or let's start by saying that cannabis for self-cultivation, using the Spanish Cannabis Club model, for instance, would be a way forward. We are not bound by the market. We can control it. At the moment, we don't. At the moment, we've got a free market, only it happens to be criminalized. Let us now have social intervention and sort of a policy process whereby the market is brought in line. The other thing I want to say is when it comes to corporations, I'm not that afraid of them. I think corporations have also brought lots of benefits. They create jobs, they create prosperity, they create tax revenues. I don't want to introduce a sort of socialist agenda by the back door that now clamps down or cracks down on big corporations. They've got a role to play in this as well.
So, Arun, does that appeal to you at all? The idea that Axel isn't talking about decriminalisation, he's talking about the law being used in other ways, so that if drugs became legally available, there would be other laws governing their use, and perhaps that might make your business more easier to carry out.
I think you're never going to get rid of the black market in terms of supply of drugs. I mean, you look at the impact alcohol and cigarette, rightfully, the impact they're having on society. I mean, as frontline workers, often, issues around cannabis, schizophrenia, we find that with cannabis, it affects so many parts of the regions of the brain, and therefore it's causing all of those problems. So I don't think by legalization, you're not going to get rid of the black market. Even, legalized methadone, which is, a form of opium, is still being abused by overwhelming majority of people that do use it as a substitute. They're abusing it. They're using on top of their addiction. They're using on top of their heroin. If you look at, buprenorphine, people still abuse that as well. So that it's legal, but there's still the possibility of abusing. And so I don't think, there's a way of actually, for example, you bring out a level of cannabis with this potency. How do we know that in the black market there's not going to be another level that's going to be a lot stronger? So just by...
Well, I guess the example that people might use would be prohibition in the United States. It's probably the only large-scale example that we have, and before prohibition existed and after it was abolished, there hasn't. I mean, I'm sure there are various forms of illegal distilleries and so forth, but by and large, it's completely marginalised the illegal alcohol trade.
Well, I mean, it has. But then, do we want a society with addiction? Do we want a society that's brought up on those messages? I know what Axel was saying around individual. And actually, addiction doesn't just affect an individual; it affects the family and the society at large. And I don't think you're really ever going to get rid of the black market and the criminal aspects behind it.
Roger, let me come back to you because I asked both my studio guests this, but I don't think I put this to you quite as clearly. You highlighted the decline in drug use. You were indicating that you didn't think it was because of the way in which it's criminalised. But what do you think? What is the explanation for the decline in drug use? Because I'm sure that's foremost in many people's mind here.
I don't think there is one single explanation. If we knew what it was, we'd be very rich people. I think it's down, as Axel suggested, I think it's down to a number of factors around culture, around fashions. I think also as well, if we look, cannabis is by far the largest drug that's consumed in volume terms and numbers of people. 70-odd% of the market is probably cannabis. And if we look at there's been a shift in that. So we've herbal cannabis, so the leaf and things like that has become a much bigger share of that cannabis market. And I think that if you look over the years, there's been a decline in smoking. Smoking has become unpopular amongst young people, and of course it's mainly young people that are using drugs. Not only, obviously, but mainly young people. So I think there's things that you could argue that it's fairly plausible that the decline in smoking has paralleled this. People decline to smoke the stuff now. So I think there's a number of explanations. But I think the important thing is that none of us, and we point this out, nobody can be complacent, because we've only got to look at the numbers of young people, and particularly young men who are not in education, employment or training. And if we look back to the lessons that happened in Britain in the 1980s, where we had big deindustrialisation, we had a huge increase in problem drug use. And one wouldn't want to shroud wave, but there must be a concern in policy circles and political circles at the moment that the current economic status might trigger more problematic use, and we may see an increase in that, but that's speculative.
Axel, what do you think the political chances of this government acting on the report are?
Well, I think the government is looking for guidance at the moment. The drugs strategy, as I understand it, is very much based on notions like recovery. We've been there before and we've tried and tested them. And I'm a bit disappointed that David Cameron, who did, when in opposition, signal that he was open for a review of drugs policy, has changed his tune since coming into office. And also with the Liberal Democrats, who, again, were fairly open-minded when in opposition, have not really taken on this issue. I'm not entirely sure, but the decriminalisation is where it's going de facto. In most parts of the country, most people will not be charged with simple drug possession. So we have a de facto decriminalisation at policing, at sort of street bureaucracy level, as we call it, at policing level going on already. It would be good to actually make this more formal and move forward, so that, you know, you're bringing up this issue of what kind of society do we want. We do not want a society that encourages addiction, you could say. On the other hand, we are a freewheeling market society, so all the time we're trying to get people to consume, which in a way is very similar to what happens with drug problems, you know, that you get caught up in this consumption as a form of behavior. But what kind of society do we want? Do we want a society where young people get stopped and searched? Do we want a society where people get arrested for something that they do to themselves? Do we want a society where large numbers of people, I'm talking about 15,000 people that are in prison at the moment, for very long periods of time, tearing families apart, pushing people into this revolving door of criminality, all to do with mind-altering substances? Why do we do this? We want to protect them from themselves. I think it's fundamentally the false approach. It's flawed. We don't need the criminal justice system to protect people from themselves. We've created an entirely new complex of problems.
So what do you think about that argument?
I completely disagree, and I think it's very important that we play the policies play a significant role in our lives. Then we have a lawless. What we're going towards is, I know it's an upward battle, then we're going towards a society where we think, well, actually, it's a problem, so let's just legalize it. And I don't think that's the basis of an argument. If you look at addiction, often people will report that, they're not themselves anymore. They can't control themselves. So we look at issues of triggers, we look at issues of withdrawal, and the actual impact that it has on individuals. If you look at the, PRUs, people referral units, overwhelming majority with behavioural problems have issues around substance misuse. And early, if we can identify them early enough, then we can tackle them. And I think by saying, well, actually small amounts, we look at tolerance as part of addiction. It goes up. So when is it small amount?
If you're saving people from their own addiction, would you also criminalise tobacco smoking, for instance, knowing that it kills people?
Well, I mean, if it was my way, then
You would.
I would criminalise it
Okay,
because
king-size portions at McDonald's that leads to obesity. Would you criminalise that too?
well, I
Where
mean,
do you draw the line?
Well, where you have to draw the line is the actual impact it has on society. Cannabis does have an impact on society. Yes, with food, they impact the same regions of the mind as do drugs. But food is for survival. Cannabis isn't for survival. Why? And where it impacts society in such a way, why are we going to take such a laid-back approach?
Alex, let me ask you one point about your line of argument here, because I mean it's an attractive point, I'm sure, to many people to say, all right, these people are making free decisions, but then whenever we talk about why the use is going up or going down, we refer to social factors. So we aren't actually, as the sort of free market ideology has it, a sort of series of isolated atoms bumping around the society, making our own individual decisions, and we can either hang together or hang separately. Actually, what's happening is that things like poverty and deprivation and family background and so forth are draining the actual notion that you're making a free choice out of the decision. So that argument doesn't quite take us all the way, does it?
No, not entirely, absolutely not. We are social beings, and we're influenced, as I said earlier, by culture and fashion and advertising. We're all easily influenced by these things. But in the end, where is the subject? Who's the decision maker? And we are rational beings. We need to be responsible for our own behavior. The alcohol industry at the moment, and the government tells us to drink responsibly. Maybe that's the line we should be taking with other substances too. Take your substances responsibly. It's up to you, and you carry the consequences in the end. The line, I mean, you would criminalise tobacco smoking. I find that difficult to reconcile with the other ideals I have in a free society. And on what basis are you making these decisions?
I mean, the real question is, are you really free in this society? We're talking about consumption, we're talking about pressures, what you are referring to. I don't think you're really free in society to make, because there's so many pressures to be within a society, and you follow the trend of that society. So how free are you when you follow those trends?
You're not really free. Roger in on this. Roger, just sort of reflecting on this debate, what do you think the government's likely response is going to be to these arguments and indeed to your report?
Well, can I come back
of course.
to that? But can I just pick up a thread in the argument? Axel was talking, in a very abstract way about protecting the liberty of the individual and individual behaviour. And I think everyone would accept the state. Its first duty is to protect its citizens, and sometimes that means protecting citizens from themselves. So, example, we wear crash helmets if we drive motorbikes. We wear seat belts to protect ourselves and to protect others that might be in the car. So society has accepted the general principle that we can do things that protect individual behaviour. I think the big question is the use of the law and the criminal penalties for this particular type of behaviour, is it proportionate? And what we have argued in our report is it's undoubted. You cannot disagree with the argument that many people get pleasure from these substances. Let's leave aside addiction. We know that it can spiral out of control, and with young people with their brains of informative stages, cannabis can be harmful to that. So there are things that we have to do to protect the young people, but what we are saying is in our report is that we should be recognising what we want to do is to encourage responsible behaviour. And the way we do that, if I pick up Heron's point, is we do need to have public education, public information around what pleasures and benefits and what harms are in this, and we having a sensible debate about this.
Okay,
so
well, Roger, I'm afraid I'm going to have to bring you to a close there, because that's about all that we've got time for in this half of the programme. But do come back after the break and join us for another discussion on the question of extradition policy in the UK.